Hi, I'm Dr. Kessler. Thanks for tuning in. And I'm a licensed chiropractor here in Virginia Beach, Virginia. And we're in the center, which is a multidisciplinary healing center, of which I'm the resident chiropractor here and kinesiologist. I've been practicing chiropractic for the last 25 years and something called contact reflex analysis for the last 14 years. And contact reflex analysis is a form of kinesiology or muscle testing to assess the needs of the body. And there's a term in medicine or healing called homeostasis, and that word means that the body is always trying to make itself healthy or whole on its own, but it can only go up to the weakest link or whatever impediment is holding the body back. And in contact reflex analysis, it's a system of testing different reflex points on the surface of the body that represent what's going on inside the body. Very much akin to Chinese acupuncture, but we don't use needles. We use mostly nutritional protocols, low force chiropractic, and some energy balancing techniques as well. And in contact reflex analysis, I check a patient's, it's called muscle testing, using their arm to assess what's going on inside the body. And through these different reflex points on the surface of the body, we're accessing something called the autonomic nervous system. It's like the biocomputer of the body. It runs the body. And it always knows what the body needs at any given time to bring it back into balance once again. And the beauty of this system is that the autonomic nervous system can follow a link of causality with many links back to what the true problem or etiology of the body is. Very often when patients come in, they have symptoms, and certainly I want to help them with their symptoms, but the body understands not only helping the symptoms, but where they originated and what to do to help them on a more profound, lasting level. And I wanted to give you an example. In my clinical practice here at the center, I can have 4 patients, different patients coming in with the very same symptom. We'll say, for instance, right shoulder pain. And even though they're presenting with the same symptom, the first patient may have a sick, under-functioning gallbladder, which will refer pain into the shoulder, the right shoulder. A second person may have a chiropractic subluxation, a misalignment in their spine, affecting and causing right shoulder pain. A third person could be flat-footed on one side, throwing off the mechanics of their body, also making their right shoulder hurt. The fourth person may have an under-functioning thyroid, which very commonly can cause upper back pain and right shoulder pain. So even though all 4 patients have the very same symptom, when I test them through contact reflex analysis, the body will show in their particular case how to design a protocol to help them unique to their particular situation. There's in the healing field for the last couple centuries, there's 2 camps of thought. There's something called mechanism, and mechanism is looking at the body as a bunch of machines, the liver, the kidneys, the heart, the lungs. And out of that, we have in traditional Western medicine many of the different ologists, the cardiologist if you have a heart condition, the nephrologist if your kidneys are giving you trouble, a gastroenterologist if you have digestive disorders. They've taken the body, and even though they're specialized in the field, in a sense they've fragmented it. CRA is from a branch of healing or a school of thought called vitalism. Vitalism is looking at the body as one interactive whole, and contact reflex analysis comes out of that. Chinese medicine comes from that particular background. Ayurvedic medicine from India comes from that particular background. In other words, what does the body need to bring it into a higher level of functioning or organization? So what I'd like to do right now is I'm going to bring in a patient. Her name's Crystal, and we're going to evaluate her. Crystal has been a patient of mine for the last several years, on and off for various health problems, and we're going to do a little interview with her to see how this particular technique has benefited her. And we're also going to test her as well, so you'll be able to see on camera, if you were to come in to see me, the type of protocols and procedures that I would be doing for you as well. So we're going to cut, and we'll bring Crystal in. Thanks for watching.